Right up front.
All right. Okay, so did everybody find the pharmacology review thing? It starts with terms. Find out. Okay. This is basically, I went through the pharmacology textbook last time, and just chapter by chapter, and I was most important picked out what would be most important as far as what you need to know. So we're just going to hit the highlights, right? This is not pharmacology. You've already been through there. If you have questions, I'm going to give you the information. If it doesn't make sense, stop me. Because it's just like everything else. If you don't understand that, you won't understand when we keep going. Okay, so stop me. Let's explain it, talk about it, and then we'll keep going. But it's just the basics. And then the part about pharm on this test, which is your goal, right, is you just got to memorize them. So if you haven't already started your pharm cards, get them. Get them and start doing them. The NCLEX is all generic names. So, I would write the generic, but then write the trade name too, just so that you can recognize it. Because a lot of us kind of know trade names and what they're for at least. But we forget those long generic names. So if you put them on the card together, your mind will remember them. Alright? Okay, so pharm, it's broken down into classifications, all drugs. And this is all on the front. If you didn't get a good pharm beginning, I kind of clarified it for you on those definitions. An agonist does what? Somebody that's agging something on, what are they doing? They're encouraging. They're encouraging that action, okay? So if it's an agonist drug, let's say that we want it to do a certain thing, that's what an agonist does. It's going to encourage that action. If it's an antagonist,
Stops it.
yes, it's trying to stop it. It's like the peacemaker say, no, don't do that. Okay? So, and then you've got your desired effect, whatever you want that drug to do. So if it's a diuretic, what's our desired effect? Diuresis, get rid of water. That would be the desired effect. That's what we expect. That's what we want. If it's a adverse effect, that can be, it's a side effect that we expect, but it's a little bit more dangerous. Let's say the adverse effect was, let me think of a good drug example. We wanted to lower the blood pressure, and we gave a drug, and it lowered the blood pressure, so it worked. It did what it was supposed to do, desired effect, but it lowered it too much. Now we have an adverse effect. It's bottomed them out. It's too low. Okay? So it's an expected side effect, but it can cause damage. Okay? And then side effect is just, it's the same thing, something we expected, but it's not as serious. Okay? So just kind of get those terms straight in your head, and that will help you understand when you're reading about these drugs. Okay? What does half-life mean? When you take that medicine, your patient takes that medicine, the body starts breaking it down. And from the time they put it in their body till it starts clearing out of the body, that's called the half-life. So the reason that's important for us to know is because if I give them something and it's got a long half-life, like hours before it starts clearing out of the body, I know to be watching them during those hours, right? Or if it's a short half-life, means I give it to them to lower their blood pressure, but it has a short half-life. It only lasts 30 minutes. Guess what in 30 minutes is going to happen? Blood pressure is coming back up. So that's why the half-life is important for nurses. It gives us a time frame of what we're looking at, when to expect symptoms, and what to be watching for, okay? So does that make sense so far? Okay. Indications is just what it's for. Like if the drug is a hypertensive, it's for hypertension, blood pressure med. Contraindications is the what, when, and why med should not be given for a patient. So let's say, if you're allergic to something, or let's say you had a medicine that is potassium, like a diuretic. It's potassium sparing. So somebody who already has too much potassium in their blood, like renal failure patient, they don't need that, do they? Because they're going to build up too much potassium. Okay. So those contraindications are important because it tells us whether we should give that drug to that patient or not. And you as a nurse, when they ask you those questions on your test, you've got to kind of know, okay, that patient shouldn't be getting that drug. And that's why they're asking you those kind of questions. Because they want you to see if you understand the contraindications. What kind of patient shouldn't be getting that drug, okay? So when you're making your cards and you're reviewing your pharm, think about that. Is there anything on that farm, when you're reading about it, anything on that drug that, hey, that sticks out to me? That's something I would need to know as a nurse. Why would I give that to somebody, or why wouldn't I give that to somebody? Jot that down and it'll stick out in your head. Okay, so let's look at alpha blockers real quick. Everybody get a handout of an alpha blocker. Is it like 100 degrees in here? Or is it? Yes. Where is our thermostat? Does anybody know? I've never been in this classroom.
At the front and it, and all this.
Lord, I might be busting out glass here soon. Alright, everybody find the alpha? We may not have one. Let me look. Alpha blockers are just they're just old. They've been around forever. They're just a class of drugs that block alpha receptors. Do y'all understand what a cell receptor site is? I don't think y'all got this, some of y'all, when y'all had pharm, on your teacher was. Let's say this is our cell, a blood cell anywhere in the body. It can be a tissue cell, muscle cell, heart cell, blood vessel, wall cell, just a cell in the body, okay? Every cell in the body has these little, receptor sites, little circles, okay? Just like a hole, okay? All over it, covering the whole cell. Those are receptor sites. Different things in the body know to go to that cell, to the membrane, and stick to those receptor sites. Almost like a peg in a hole, or whatever this is. Let's say it's a broken down particle of a medication. It knows, oh, there's my spot, and it goes and sticks there. It actually goes into that receptor site and sticks on there, and then that cell takes it in and starts working with it. So that's why receptor sites are important, because scientists figured out every cell has these, and whatever we put in our body is going to find that cell, whether it be food, because glucose goes into the cell, right? And that's how we keep our blood sugar up. Or if it's insulin, now insulin figures out, oh, I need to go right here, and that lowers our blood sugar, right? So medications do the same thing. They go to those receptor sites, and they either block it, or they connect, and the cell uses it. So alpha blockers are alpha adrenergic blockers. They go to that alpha receptor site on that cell. So they've got different kinds, and they literally go and they plug that hole, that receptor site, so that whatever that is in the blood can't get into that cell. Okay? So they go to the cell walls of smooth muscles. Now, what's smooth muscle? Like your blood vessels. Those are smooth. They're still muscle because they contract and dilate, right? Is your bladder smooth muscle? Yes. Yes, it needs to stretch and expand. Colon. What else is some smooth muscle? Prostate. Things like that. So those cells, this drug, these alpha blockers, they go straight to those smooth muscle cells. They find those smooth muscle cells in the body and they stick to it. And they block that receptor site so that whatever is needing to get in there can't get in there anymore. Okay? And we all know once the stuff gets in the cell, that's when all magic happens, right? That's when everything starts working out. So when you have an alpha blocker, they go and they block that site, smooth muscles. They keep adrenaline. Adrenaline's floating through our body. Remember, that's one of your neuromuscular junction chemicals from going into the cell. What does adrenaline do to our body? Speed us up. So if I had too much adrenaline in my bloodstream, these receptor sites say, oh, there's too much. I want you in my cell so that I can take some of that out. But these drugs go and block that because they already know inside we don't need any more adrenaline. Our blood pressure is already too high. Our heart rate's already too high. So this drug goes and blocks that so that adrenaline can't get in the cell, therefore keeping the blood pressure and the heart rate low. So these are the kind of patients you would give this to, right? Think about it. Somebody who's already has high blood pressure. They start off with alpha blockers. All right? Because they block that adrenaline from going in the cell, and it lowers the blood pressure. It lets those vessels relax and open up, because when we dilate, that lowers our blood pressure. Just think of like a big pipe. The bigger the pipe is, more water can flow through, right? The pressure's lower. But if you have a small pipe and you still got all that water trying to rush through, doesn't that increase the pressure in there? So that's the same with your blood vessels. When they're larger, when they're relaxed and dilated and larger, it lowers your blood pressure. More blood can flow to wherever it's needed to go. But when it's smaller and constricted and tight, the pressure goes up, and you're not getting blood flow. And if it gets too tight and constricted, what happens to that tissue? The tissue dies because it's not getting any blood flow. Okay? So alpha blockers go in and they help open us up. They block that adrenaline. It's going to tighten everything and speed us up, and it opens it up and relaxes us, lowering the blood pressure. Okay? So when you think of that, if I give you an alpha, may say it's an alpha blocker, you'll think, okay, that's a dilator. It's blocking adrenaline. It's going to lower the blood pressure. All right? And if their blood pressure is too low, what would your nursing measure be before you gave it? You hold it. Okay? So that's pretty much those, real quick, okay? They give these sometimes, like let's say if you're having a cardiac event, like a heart attack or a stroke, and your blood pressure is super high, they go ahead and give you these IV because they lower that blood pressure, taking the stress off the heart. They're opening it up so that the heart muscle can get blood flow, okay? Sometimes they'll give these in a lower dose to women who have urinary incontinence. Because remember, it's a smooth muscle receptor site. It goes to those, and if you're having incontinence, it helps with that. Bladder control, and then with enlarged prostate. So all of that's on your paper, just to give you some kind of examples of what they might ask you, okay? These are not the first line of drug choice anymore because they really realized they were old when they came up with new stuff, but they realized that it wasn't being as effective. It was dilating, but not as good as they needed, and the tissue was still dying. People were still having strokes. It wasn't working right fast enough anymore, so they don't use those anymore. Every now and then you'll see an elderly patient that's still using them, and that's only because the doctor doesn't want to change it. They've been on it for years. They'll leave them on it, but just know that alpha's the beginning, right? So think about that. Alpha, that was one of the first line, the oldest. Okay. These are also like the nitrates, your nitroglycerin. Okay, they vasodilate. Vaso meaning vessel, dilate open, and they lower everything. They relax those vessels so that your blood pressure drops. Sometimes they give these. If you're having chest pain, they still give nitroglycerin, or they put the paste on them. They give it sublingual. Nitroglycerin is the tablets that you put 3 under your tongue sublingually. They give it nitroglycerin in a glass IV. It has to be in a glass bottle because the plastic IV bags will deteriorate the nitro. So you'll see an IV glass bottle of nitroglycerin, or they put the cream on. Okay. Some of the pills they give are Nitrobid or Izervil. Those are some of the nitroglycerin ones. Now the bad thing about nitrates and anything that dilates you real fast causes a severe frontal headache. So because you're opening everything up, okay, and it just bottoms you out. So that might be a side effect that they want you to teach about on these dilators. Your patient comes in and says, I've been taking this pill for 2 days and I have a severe frontal headache. Is that something you would expect? Yes, but what would you check? The blood pressure, make sure, and then you would report it to the physician, right? Okay. You don't want to have to take all these different things together. Sometimes you'll see these older patients with 2 and 3 of these from one class, still on them at one time. They're probably going to be a low blood pressure, so we have to be real careful with those. Cold rooms and nicotine can adjust things, right? If the room's cold, what do you think your blood pressure is going to do? It goes up because your body starts shivering. It says it's cold and regenerate heat, so it speeds everything up. If the room's hot like it is right now, I bet my blood pressure, I'm dilating, so my blood pressure is low. Nicotine, we know, speeds us up, constricts our blood vessels, so that's raises our blood pressure. And then we need to, if they're already on these meds, we don't want to, we don't want to keep giving them that kind of stuff. All right. Any questions on that? And another little tidbit about nitroglycerin, the little bottle ones that they keep in their pocket, a brown glass bottle, the ones they put under their tongue, can't be in sunlight. You know that, right? That's why they keep them in a brown bottle. The sunlight damages it. Okay. Those are some teaching things. And you have to replace them every 3 months. If when you put nitroglycerin under your tongue, they'll say they have a frontal headache or a bad headache. If they aren't having a headache from it, that means that nitroglycerin is no good anymore. You need to throw that away. They only last for 3 months. So if they're not getting they used to say if it didn't tingle, it wasn't any good, but now if they don't get a headache from it, they're no good. All right? So that might be something they ask you. Okay, so we'll questions on alphas. They're pretty easy. Dilate. Right? Pretty easy. Just worry about final headache and blood pressure thing. Alright, beta blockers. Y'all find your beta blocker handout. I think it had.
It's right underneath that one.
We'll have it right together. Oh, y'all care about opening the door? Okay, beta blockers are, again, anything that's a blocker, what do you think it's blocking? A receptor site. So it goes to the beta receptor sites on the cell, okay? And it's doing the same thing. It's binding with those receptor sites to block epinephrine or norepinephrine. Those are the same things, adrenaline, okay? There's beta-1 receptor sites. Those are on the heart, eyes, and kidney cells. So if you have the heart cells pick up on these beta-1 kidneys and eyes, they all have beta-1s. Beta-2s are in the lungs, GI tract, liver, uterus, blood vessels, and skeletal muscles, sorry. And then beta-3s are in the fat cells. So, depending on what's happening to your body, this drug knows where to go. And it goes and it sticks to that beta site, okay, that receptor site. And these drugs are used to reduce your heart rate. Because remember, they're blocking what? Adrenaline. Adrenaline. What does adrenaline do to us? Speed us up. So if somebody comes in and they're in VTAC or they're tachycardic, do we want them to have more adrenaline going into their cells? Because what's a response when you're nervous and scared and you're worried you're having a heart attack? Your body secretes adrenaline, right? So we immediately give them a beta blocker to slow them down, to block that so that no more adrenaline can get in their cell and raise them up even, speed them up even higher. And so then that helps kind of calm them down and get things back to where we need it to be. So they're used to reduce the heart rate and blood pressure because they do the same thing. They dilate. So that helps with angina. I used to say angina because I'm country. But anyway, angina. And so they open everything up, right? Anytime anything's dilating, just think more blood flow. So then, isn't it a good thing for our tissues to get blood, right? Because that's what's causing that ischemia or that angina is that there's not enough blood flow there. It's cramping. The tissue's cramping. It's saying, I need blood. Just like a sickle cell patient, when they're sickling in the blood vessels, the muscle doesn't get that blood, and it cramps and hurts. That's why sickle cell patients have cramped muscle. Same with your heart. So this dilates everything, okay? And helps open everything up. The one thing about this one, though, remember it has receptor sites in the lungs. So it goes around those muscles that are in the airway, bronchial tree, and it can actually make those muscles squeeze. Now, with somebody who already has trouble breathing, let's say an asthma patient, would that be a good thing for them? No, because they're already squeezed tight. Their airway's narrowed to begin with. So do I want to put more squeeze on that? So those are the people who cannot take a beta blocker, somebody who has asthma, okay, or restrictive airway disease. So that's always why we ask about their history before we give them a pill, a new drug, okay? Anything that's going to run up their adrenaline, this is what this one's for. It blocks that so that you can't get any of that. It lowers your heart rate, blood pressure, and it dilates you, okay? These are all the LOLs, the LOLs. So anybody think of one off the top of your head that ends in L? And I think I gave you all a sheet with them handwritten. The beta blockers are the LOL? What the LOL about? There's a bunch of them. These are older too. So metoprolol, that's low pressure. You may have heard that one. Or Topol. Does anybody have a dad or somebody relative that takes Topol? My dad still takes low pressure. Topol. It's been around forever. Propranolol, it ends in LOL. Okay, the generics end in LOL. These are all beta blockers. So just know those. But like I said, they're on here. The examples are on here, and learn the generic names. Okay. Now the side effects of both of these, let's think about it. Let's think about the physiology. If it is dilating you, opening everything up and slowing everything down, what would you think that's going to do to your neuro status? It's going to suppress you. What happens if you're not getting enough blood flow to your brain? Say it, y'all know it. Say it. You get dizzy, you get confused, disoriented, right? If you're dilating everything and you're slowing the heart rate down, it takes longer for that blood to pump up to the brain. That's why they start feeling dizzy. That's why they get low blood pressure, hypotensive. That's why when you're changing them from sitting or laying to sitting to standing, they get real dizzy because they can't adjust to that change because their blood pressure's so low, okay? So the side effects of both of these alpha and beta blockers, they're going to be dizzy, fainting, because again, the heart rate's low and we've dilated them, low blood pressure, and sudden change in blood pressure from sitting and standing. All this is on your handout. Headaches, again, because we're dilating them, so they're going to have that frontal headache because all of a sudden there's no blood flow up there. They might be drowsy. These are people that, you know, they say, my blood pressure just washes me out. They feel weak. They're drowsy. Okay? And then sometimes they'll have nausea and vomiting and constipation. I think every drug on the market has that. And then shortness of breath. Because again, your heart and your lungs aren't getting up. You don't have one of these? No. So, this is when it goes to farm review.
No, I have that. I don't have that part. The pages.
Make a list of what you don't have and I'll get them for you. Alright, so just remember those. There's a good table of this on page 228 in your farm book, if y'all still have your farm book. It gives all the side effects, you know, so if you're doing cards or just jotting down stuff to help you, whatever makes you remember farm. But there's some on there for hypertension and diuretics, page 228. Okay? Those are pretty easy, right? There's just a million of them, so that's why I gave you the shortcut with the handout that has the shortcuts. If they end in law, what are you going to think? You're going to think generic. What else are you going to think? Beta blockers, slowing my heart down. BB, I think of beat, like a heartbeat, you know, and it's slowing me down. Whatever you can think of that makes it make sense to you, easy way to remember it, because there are a million, so you have to just find a quick, easy shortcut. Alright, and then there's the combination of alpha beta blockers. Those are called the twofers. Guess what they are? They block alpha receptor sites and beta receptor sites. So they're a double whammy. Alright, these are called twofers. Some examples of those like Coreg or labetalol. They lower the blood pressure, heart rate, they do all the same things. Sometimes they'll give them with a diuretic because we know that getting rid of fluid helps lower our blood pressure too. Yeah, but they're all the same. It's alpha beta blockers. So
then these are beta blockers.
because this one is a combination. So this one is a combination of these two. These two had a baby and they made out.
So how can we distinguish them?
You don't have to because they're going to do the same thing. Law.
And then just remember, alpha beta blockers is a combination of mother and father having a baby.
And they're going to do the same thing. They're going to dilate. Side effects are the same. They're going to feel washed out. These are really going to feel washed out because we've added a little bit of diuretic to them. And so when we lose our potassium, does that make us feel washed out too? Yeah. That's why I'm going over to farm. Because it's been a while. And when you take farm, you're in level 1. You don't even know what you're doing. Okay? Again, remember, this is something that they might ask you about. For alpha beta blockers, they're contraindicated with heart failure. Why do you think people with CHF can't take these? What's the heart doing if they're in CHF? It's slow. It's slow. So do I want to give them something that's not slowing down even more? Because then they're going to have even less of a heartbeat and more swelling, right? The pump's already slow and not working, so I don't want to give them that. What about somebody with asthma? Do they need one of these? No, because we already said it. It's on those smooth muscles in the bronchial tree and squeezes their airway. So if they have asthma or restrictive airway disease, they don't need one of these. There's other stuff we can give them, okay? If they have a heart block, you know what a heart block is? That's where you have the irregular heartbeat. Now you're going to bump, 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 bump. Bump, bump, bump. Yeah. They already have irregular heart rate and slow heart rate. I don't want to slow them down even more. They need some adrenaline, right? Okay, and then pregnancy, you know, we're going to be careful with that because we don't want to hurt the baby. We don't want to risk the baby not getting any blood flow. Because remember, it's relaxing the uterus. And where's the baby located? Yeah, so I don't want to give that to a pregnant lady. Because if we relax the uterus too much, she could
So why don't we want to get the station? Because their heart is really
Yeah, they already have a low heart rate, and the desired effect of this is to lower the heart rate. Okay, the side effect is it lowers the heart rate. So if somebody already has a low heart rate, like a CHF patient, we don't need to give them this, because then they're going to go from 60 to 30, and then they won't be conscious.
They're all
Most of these are the alpha beta blockers are low rates, and they, but the generics usually are low. Trandate is another one that's an alpha beta blocker. It's a generic. Alright. Any questions on alpha blocker, beta blocker, and then their baby, the alpha beta blocker? Same stuff, right? Same side effects. When you know the categories, you don't have to memorize it because they're going to do the same thing. If you understand what the drug does, then you just automatically understand what is going to happen to the body, and then you know what to watch for. Okay? Alright, so calcium channel blockers. What does calcium do to our body? Why do we need it?
for bones.
It helps our bones, but it gets in the bloodstream, and muscle, it excites muscle, right? It's what makes our muscles move. It's like what helps the nerves fire off and tell the muscle move, so that we can walk and move around. Okay, it's an exciter. It's exciting. Okay? So this class of drugs for calcium channel blockers, they're going to the calcium channel site on the cell, and they block it. Because they say, I'm already too excited in here. The party's too rowdy. I don't need any more calcium in here. So it blocks that from going in. Okay? So places that it would block, some of the muscles, like, your skeletal muscles, or the heart muscles, or blood vessel muscles. Okay? Because we don't want them to get too excited, because if they're already too wound up, they don't need more. So we give them a calcium channel blocker. They slow down and prevent calcium from entering the cell or the blood vessel walls, and that helps it lower the blood pressure. So it's doing the same thing. This one might be, these other two drugs, alpha and betas, didn't work, so now we're going to go to a calcium channel blocker. For whatever reason, the patient couldn't take the alpha and betas, and now we're going to try a calcium channel blocker on. Because it does the same thing. It dilates them and opens them up, but it has a different kind of action, so what wouldn't work before might work with this one. Okay? So these are helpful with high blood pressure patients, migraines, and Raynaud's. Do y'all know what Raynaud's is? They may throw you that one on the test. It's just where their circulation doesn't work very well, especially in cold temperatures, and their extremities, like their toes and their feet, start turning like dark purple and red. Poor circulation. It's in high altitudes or cold. So this is a dilator, so what do you think that's going to do to that tissue in the feet? It's going to dilate it, letting more blood flow back. So that's why they give it to people with Raynaud's. So it lowers the blood pressure, lowers your heart rate, and it's going to relieve chest pain. So if somebody comes in with chest pain, you'll give them a calcium channel blocker. And sometimes it'll control the irregular heart rate. Because a lot of people already have that funny heartbeat that's really excited and overstimulated because they have too much calcium. Too much calcium is going in those heart cells, exciting them, and that's causing the irregular heartbeat. So we give them a calcium channel blocker. It goes in and blocks that and says no more, and that helps the heart rate level off and be more regular and not so excited and irritated. Okay? So we'll give those kind of people, if they have an irregular heart rate, we'll give them a calcium channel blocker too. Okay? The bad thing about these, they sound like a miracle drug. Bad thing is they're short acting. So they start working, they go in and they work good, but they burn off quick. Just like everything, just like a man. They start off great, and it's over in 5 minutes. No, not It's sweaty present company. But that's how they are. Just think about, they get in there, they do the job, but then they're done real fast. Okay? So, and then they have the long acting, they figured out, these aren't working as we need them to last longer. So they have a slow release. They encapsulated them, how you can do the enteric coated. So it takes longer to eat that coating away, letting it last longer. Okay? We all know length matters. Like that. So I don't know why my mind always goes there. Sorry, y'all. Trying to make this less dry.
30 miles.
What do you remember it?
Yeah, it does help you remember. So think about that. Calcium channel blockers, they get in there fast, but they burn off fast, so sometimes they'll give them the extended release one, okay? When the calcium enters the cell, like I said, it makes them contract and squeeze. So if the muscle's already excited and tense, we don't need any more calcium, so they block it off. They help it relax, they help dilate, and that helps lower the blood pressure and heart rate, and relax muscles. So, no, it helps skeletal muscles. So when calcium enters the nerve cells, though, is it can enter a nerve cell too. Remember when we did the little string experiment? Remember, those are all a bunch of little nerve cells lined up. Calcium can also get in there because it likes to. It's exciting and wants. It's almost like electricity. Calcium is. It helps liven everything up. So when it gets in the nerve cells, it can send signals to the muscles, causing them to get too tight and tense, like tetany, or during a seizure, right? You know, your muscles all tense up because all that calcium is being fired off and getting into those cells. So we give them a calcium channel blocker to slow that down and slow those electrical impulses, blocking it so that it doesn't excite the muscle so much, okay? So these are on page 225 in your farm book, some examples of them. Amlodipine, which is Norvasc, diltiazem, cardizem, Procardia, Kalan, Cavera, all of those. They lower the heart rate real quick. These are the ones that we use more like in emergency situations, like VTAC. Somebody comes in VTAC, we shoot them with IV calcium channel blockers, yeah. So, just kind of know those. Those are really good ones, but they work good, but they're fast. They burn off quick. That's the side effect of those, okay? Now, there's something that we can't take with these because they decrease the effectiveness of this. What do you think it is? Antacids, yeah. Can't take antacids with these. Guess what the side effects of something that's dilating you and lowering or opening you up? Guess what it's going to be? Dizziness, fainting, low blood pressure. All the same things, y'all, because it's doing the same thing. All right, so the side effects are listed there. Any kind of medicine that's lowering your blood pressure, expect to be dizzy, weak, risk of fainting or falling. So I'm going to take them slower, aren't I? Those kind of patients. It's going to be easier with them, okay? You get a headache, all that kind of stuff. I think y'all have a calcium channel blocker handout for that. Okay. They're all the same side effects on there. Alright. On page 225, there's a list of it. We're going to angiotensin now. Angiotensin converting enzyme. These are your ACE inhibitors. What this stands for, this is the next section. ACE inhibitors, those are a real common one that they give now. And that ACE stands for angiotensin converting enzyme inhibitors. That's what I got ACE from, okay? And this kind of drug goes and blocks the enzymes that produce angiotensin. Angiotensin is something that speeds us up, stimulates water and sodium to be reabsorbed in the kidneys, okay? Angiotensin stimulates aldosterone, and aldosterone is what makes us hold on to water and sodium in our kidneys, all right? So if you've got too much of this, too much aldosterone floating around your bloodstream, telling your body to hold on to sodium and water, what do you think your blood pressure is going to be? High, because you've got too much volume, too much fluid on board. So these ACE inhibitors, they go and they block angiotensin and aldosterone from getting in that cell. So now, instead of the message going in there saying, hey, hold on to all that water and salt, I might need it later, this drug goes and blocks it so that message can't get into the cell, and guess what you do? You pee, you diurese, you get rid of all that. And so what do we do when we diurese to our blood pressure? Lowers it. All right, we're getting rid of fluid, so now instead of having all that rushing water through that small pipe, we've got less water trickling through and our pressure's lower. Okay? Y'all know that water follows salt, right? If you've got a lot of salt, water's going to stay with it. Same with protein. If you got a lot of protein, water follows the protein and sticks with it. So if we're getting rid of our salt, we get rid of water, okay? Too much water or fluid can increase your blood pressure. That's why I said makes your pump work harder. Your heart has to work harder with too much volume. So we get rid of it. This blocks it so that we can get rid of that salt and water, lowering your blood pressure, and that takes the workload off your heart. So somebody who has chest pain a lot, they may be on an ACE inhibitor, okay? This is used for people who have, patients who have coronary artery disease. They're already constricted, their blood vessels are tight. Those are the people that, remember, they have, I think of them as the crunchy vessels. They don't constrict and dilate as easy anymore. They're kind of like a dried out water hose. Have you ever seen a hose that's been laying out in the sun for a long time? It's kind of crusty. That's what coronary artery disease is like. Their vessels are so full of plaque constricted dilator. So we give them this because it just helps get rid of water. Because if we gave them the vasodilator, it wouldn't work. They're not stretchy anymore. So we give this to these kind of patients if they have high blood pressure, again, because it gets rid of fluid. Kidney disease patients, they need it anyway. Their kidneys aren't working, so we help them get rid of that. Heart attacks and CHF patients. Why do you think CHF patients need this one? Yeah, they got fluid already too. So let's get rid of this. Let's help them out. And then sometimes they'll give this to people who have migraines because they found that it helps with that. So, the one notable side effect you need to know about ACE inhibitors is that this is the one that causes the little dry, irritating cough. You will be in a room with somebody and you'll hear it. And you're like, oh God, you need a peppermint? And then you realize, are you a blood pressure medicine? Yeah, I am. What kind? Oh, that's an ACE inhibitor. That's why you're coughing. And so you tell them, how long have you had that cough? Oh, I don't know, a couple of months. Did it start about the same time you started taking your new blood pressure pill? Yeah, it did. Okay, you can't take that one. Yeah, that one is irritating. Some people it does this too, just like everything else, and some people it doesn't affect.
I had to take my mom off of it.
Yeah.
She had it for like 2 months before we finally.
I had a coworker that I had to sit in the same office with and listen to it, and finally I was like, oh my God! Your cough is driving me nuts. Because, it was like a ticking clock. It never stopped. And she had gotten so used to it that she didn't even recognize it anymore, didn't even realize it. So I told her to go and she got it changed.
Yeah.
We couldn't live in the same office anymore. We were like going crazy. So just know that one about the ACE inhibitor. That's a little side effect they might ask you. That's a little tidbit for the testing purposes. ACE causes the cough. Okay? A little dry cough. Because it's angioedema, it's making those vessels swell, and that's what triggers the cough. Okay? Guess what the side effects of anything that's lowering your blood pressure is going to do? Dizziness, fainting, low blood pressure. Good. Y'all are catching on, see? Weakness, drowsiness, all that kind of stuff. Okay? And then there's some examples of low tension. These are all the prils, P-R-I-L. They end in pril. And this is on the one I gave y'all that I hand wrote. It's at the bottom. Any of the prils, P-R-I-L, that they end in pril, those are your ACE inhibitors. And what is an ACE inhibitor's little irritating side effect? Cough. Good. All right. Look how much y'all are learning already. I don't know. And then page 225 again, and I'm just giving y'all farm book pages. That way, if you want to go back and make cards, they're all there. That way, you don't have to search through your whole book. So those are on 225, the ACE inhibitors, and then on 225 also is the next group, angiotensin receptor. Antagonists or blockers, those are called ARBs. So this is what we put our people on who have got this little irritating cough. If they're driving you crazy with a cough, or the patient comes in and says, this little cough is just, I can't stand it anymore. It's keeping me up at night. You write that down, and then the doctor will look at it, and he says, okay, that one, we can't give you an alpha blocker or beta blocker or calcium channel blocker, so now, and this ACE inhibitor is making you cough, so now I'm going to give you an ARB. Okay? So these are they do kind of the same thing. They cause dilation, vasodilation, but they don't have that irritating cough, okay? So same kind of people, high blood pressure, CHF, diabetic neuropathy, because they don't have good circulation, so they'll give them this one. But guess what the side effects are? Dizziness, headache, all that stuff. The really weird side effect, though, is it makes them hold on to potassium. So that one might be something you want to know, too. ACE inhibitors cause a cough, but an ARB, it helps with the cough. They don't have a cough, but they hold on to too much potassium. They get hyperkalemia. Now, with too much potassium in our bloodstream does what to our heartbeat? It can cause arrhythmias, or it can slow it down so much that it doesn't beat at all anymore. That's what they put in. That's one of the ingredients of the lethal injection, potassium, because it slows your heart rate down until it stops. So we don't want too much potassium, do we? We don't want that. So if that becomes an issue, they'll change it to another one. Okay. So for that kind of patient who's on an ARB, I'm going to be checking their blood pressure, but what else am I going to be monitoring? Potassium levels. So know that, okay? So an ARB, I need to be checking their blood pressure on anybody's blood pressure, but I definitely want to check potassium level, okay? They might say, I'm cramping really bad lately. Ever since I started taking this medicine, my cough's better, but my legs cramp all the time. Check a potassium level, okay? Leg cramps are a side effect of low potassium, or a symptom of low potassium. All right, so then there's a couple examples down there on that. Alright, let's take a break.
She just contradicted herself.
Do what?
This is potassium sparing, so lead cramps will be not enough potassium, not too much, right?
Potassium spare, I don't know what you're saying, say it one more time.
Okay, this holds on to potassium, so lead cramps would not be an issue because lead cramps is not enough.
True, you're right.
Okay.
But if they say they're having too much lead cramps, check potassium level either way.
Okay.
You're gonna be checking a potassium level to make sure it's too high on this one, but then if they get too low, they're gonna say I'm having lead
Yeah.
cramps. Sorry, I got ahead of myself. Okay, so let's take a break, and then we'll finish up with our drug classifications and just a few more tidbits on farm.
I was doing this on Facebook last night, and you told that I should be a doctor.
That's good.
Yeah, it was one of your questions, and I was like, 10.
That's good.
Yeah.
Yeah, forget nursing. Let's just move on to medical school.
I told May to come.
I did too.
But she says she has a
Where
birthday,
is she?
and I said, so what? And she said,
It is
how long
recording.
is it gonna be going, how long are we gonna do this?
I mean, they're here for clinical, so it's just, this won't take long. We're gonna get through farm first, because it's the most,
What else will we cover today?
I think we're gonna try nutrition, and maybe lab work, lab studies. Because those are the three areas y'all are like struggling with. Nutrition. I'm gonna go get my water out of course.
I'm gonna go get coffee. Yeah. And patient. My comfort, teaching, care, I don't care about teaching. I know, I'm happy about it. And all your stuff, I said, but mine, you look at mine, and you're like, do you wanna go with me to get coffee? No, will you give me a second? Sure. He is focused. Focus on us.
Your little baby is so cute.
Thank you.
Why was he crying?
Because I had to go to the store last night, and he was like, "Don't leave," and I was like, "But why?" And he's like, "I need you." I tried
He
to
looks
say
like
something.
you a lot.
He does. He was like, in one of these, he was like, "Will you give me some water?"
Aw. He was fighting sleep, wasn't he?
Yes.
Thank you.
And I was literally gone for 10 minutes, and when I got back, he didn't want to leave me inside.
Oh my gosh, this is what is he doing?
My friend, he was, in downtown Dallas.
does this one have type of crayon here? I'm kind of confused, y'all. Have y'all done any more tests? Online? More ATS? Practice?
Oh, yeah.
You good?
I was able to get into that company, so finally.
Good. I'm excited for y'all. Y'all are gonna be ready.
I just want to be done with it on this try.
That's a good feeling to be done. Oh, it's not How did one get not put in there? They were front and back. Maybe it was in the other room.
No, she said, you still owe $400, but I can't pull you out of class and tell you you can't go. she said, but I'll still call you. I said, I don't have to. It's not you at all. If I have an ugly look on my face, it's something personal. It's disgusting. It's not you. No, I'm saying I've seen it before. I'll go get my granite ball. I have a granite ball. I really do. The counselor made it for me, and every time I said you were mad, I was supposed to shake it. You know what it says? It is our eyes on it. I might beat it on the. I was so distraught this year, and like all these different suicidal and homicidal. Passive aggressive and aggravated aggressive. All of it. Really? All of it. Everybody is stuff. And I have piles like toy. I go to laundry programs. You have the best moment until I trade you my mom for your mom. I wouldn't trade my mom anything in the world. My mom is doing my laundry right now too. She's like, what do kids go to school? I don't know, probably need to go to school. I didn't even know I had kids. And she told me we'll have spaghetti for supper tonight, so. I thought I'd give you kids a production. You came back?
I'm still trying to figure out one more craft to do for the kindergarten class. My daughter's in kindergarten, and their parties are today. And on the past mom, we had like 5 other past moms helping. They all decided yesterday that they're not doing anything for the party. That's today.
You can do them draw their hand. I've seen that before. They draw their hand like a Christmas tree, or cut their hand out of gray paper, and it makes like a Christmas tree. And then you got it wherever it was. It's really easy.
It's weird, like, when I can think about somebody I haven't talked to in forever, and I swear to you, I'm calling them and texting that same day. And
People come to mind, and then I'll get you know.
yeah, and then my brother, he got married in August, and he proposed like around Christmas last year. So I literally was mid-conversation with my best friend. I was telling her, we were talking about my brother and his wife, and I was like, I love her death. I wasn't meaning to be but I was like, she really wants to marry him. She's already asking for a ring. I was like, my brother won't. Like, he will not yet, because I think they really eventually, or he won't right now. I'm saying this, and she sends me a text message of her hand with the ring on it, and she's like, yes.
But the nurse thing that worked out, you can always do a I know.
This Thursday? The one that you gave us already before.
Let's just go real quick and make sure everybody got these. Nicole, some of these were in your last pack I gave you, so let's look. Okay, for alpha blockers, did everybody get this one, the handout? It says side effects of adrenergic antagonist, is a big word, alpha blocker. It tells you the same thing, and it gives you examples of the drugs, okay, so make sure you have that one, alpha blocker. Why do you think it causes sexual dysfunction?
It blocks your stomach.
Because if certain organs don't get blood flow, what happens to certain organs? They don't function.
It blocks the
So, yeah. So that's what Viagra does, is it's a stimulant. It constricts, so therefore they get blood flow. Erectile. So there's that. Okay, make sure you have that one. She's just moving up here. All right. Or Charlotte. You have to hear all this. Okay, and then for betas, did you see this one? It says B blocker. Side effects of adrenergic antagonist, beta blocker. Okay. Does the same things really, drowsiness, depression. Why do they have symptoms of CHF? These were from the other day, so
Well, I mean, I have some of them aren't in the package.
well, it's because they're in multiple packages. So you can go home and make sure you have them all. Not the one today, because this one came the other day. So somewhere in there you'll have this, because I gave you all these. But why do you think it's causing symptoms of CHF? If it's slowing down the heart rate, what's going to happen with it? Right. heart isn't pumping, and so that fluid backs up. So that's why they'll have symptoms of CHF, because the heart rate's low. That's when they start having symptoms, and that's when you say, okay, now it's time to change you. You're having, it's not helping you anymore, it's causing more problems, so let's try a different kind, okay? So make sure you have that one for beta blocker. And then the other beta blocker one is, looks like this, it has the little blocks on it, with the LOL, why do you think it has LOL on there? That's what they end in. So make sure you have that one. This tells the action, that it's lowering the heart rate. And it slows down the force of contraction. These are from this morning. Now, this was from the other day in the other pack. So, I'm just kind of making sure, going through them. You should have all of this. I don't think I have that one. It's from the other day. Alright, so, just make sure you have them and we'll do it later. So, force of contraction. It helps with the contractility of the heart. Same symptoms, lowers your heart rate, lethargy, CHF issues, decreased blood pressure, and depression, because they don't have any energy. Life just sucks now because they feel like they don't want to get up off the couch. It makes them too sluggish. Okay. So then beta blockers, like I said, are this one, they have their different receptor sites. In this one, this handout shows you where they're at. B1 is the receptor sites of the heart, and then B2 is affecting the receptor sites of the lungs. Because remember, this is the one that squeezes the lungs, the muscles around the airway. So if they have what? This is contraindicated. Yeah. Any kind of reactive airway disease or asthma, they can't have a beta blocker. So on that one, that's kind of what I want you to know on that. Okay. Next time I'll be more organized. Get all this together for y'all. Sorry. 2 hours of sleep every night. I don't know. Calcium, this one, the calcium channel blocker, looks like this one, and it'll have, it has the drugs on the little jar. There's rapamycin on it. It tells you everything it's going to do, okay? Remember, calcium excites us, so we don't want that kind of party going on in our cells, so it lowers everything, slows everything down. Even can cause constipation. Why do you think that's happening? Isn't our colon a muscle, right? And so if this calcium needs to get into my colon to make that stool move through my colon, and I have too much of it, doesn't it slow this? I mean, I have too much of this drug, it's going to slow me down, right? Causing constipation. Because it's suppressing all that muscle contractility, even in the colon. So yeah, it's helping my heart and my blood pressure, but then it's slowing all this down too, so I get constipated. Okay? I think this is just smooth muscle moves. Alright, so make sure you have that one. And then the ACE inhibitor one, it's the one that has the card on it, the ACE card. Okay? And it just does the same thing. It tells us what the side effects, the action are and the side effects. This is the one that causes the cough, right? So I can remember this one. I always remember ACE like I think of a poker game. And somebody's coughing because it's like a smoky poker room, you know? So you can, that's how I remember stuff. Alright, so if they have the cough, a little chronic cough with an ACE, what do I give them? What do we change it to? An ARB. So I put that by cough. You're going to change it to an ARB, and then you're going to need to check your potassium level because they're going to be potassium too high. Okay, you can keep me straight. And then from an ARB, not from ACE, from an ARB. Okay, all of these, we're going to check what? For all this kind of stuff. Blood pressure, because that's what we're doing is trying to lower it, and we don't want it to get too low. So the nursing manual just says blood pressure. Okay? And then there's the other one that has all 3 of them on there. So you should have all of these sheets. If you search and search, you can't find them. Let me know. Alright. I'm going to go through real quick. Let's flip over to, we got good blood pressure stuff. Let's flip over to the central alpha agonist. This is just, again, the same thing. When all those other blood pressure meds have failed, we give them this one, okay? This group. And this is in your little handout that I gave you, but just read over that. There's very few people that are on these because they're, they work by overstimulating the receptors in the brain, and that tells, instead of telling the blood vessels to constrict, it dilates them, okay? So a lot of people don't like to give this one because it's tinkering with your brain chemistry. But if you have such high blood pressure and nothing else works, this is kind of, I mean, you gotta do that or they have a stroke. Alright, so this is calf press or clonidine, and the same symptoms, dizziness, fainting, low blood pressure, all that kind of stuff, okay? No, we're on the central alpha agonist. Sorry, the page got flipped. We're just doing blood pressure. My secretary did a really poor job making copies for me. No, me. Me. Alright, so just that, like I said, that's your last one, calf press, and there it's on there. That's your last ditch. And we actually gave that to somebody, and they are all the time, and we give it to them because it acts quick and causes a really bad frontal headache. But, you know, got their blood pressure down.
Which one?
Calf press, like clonidine.
They give that to kids with ADHD or
Yeah, because it's messing with your brain chemistry. It blocks those neurotransmitters where those stuff can't get in and out of the cell. So, like I said, it's not something they prescribe daily for a lot of blood pressure unless it's not working anything else. Okay? So cardiac glycosides, these are plant-based from plant sugars. And they're just cardiotonics. They just slow the heart rate down. So tonic, I think of like a tonic. It slows you down, right? This is what this does to your heart. It slows the heart down, increasing the force. Because think about when you've got a pump and it's pumping fast, it's not going to get as much out, right? Because it doesn't have time to fill. Y'all need something? Miss Keisha, do you need something? Okay. So when you have a pump and it's beating fast, 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 not as much is coming out because it doesn't have time to fill back up, right? So what this does is slows the heart rate down so that it has time to fill up, and then it can squeeze it all out. That's called cardiac output, how much I'm getting out, okay? So it increases my cardiac output because it's lowering my heart rate. I'm not beating as fast so that it fills up with blood and then squeezes it all out. So I have a better cardiac output, getting more blood to the rest of my body, okay? So guess which one that is? Digoxin or lanoxin. And so what do you, I hope all know what you're supposed to do before you give dig.
Pulse.
Check an apical pulse for how long?
A full minute.
A full minute. If it's under what? This is what you do. Good. So that's always on there too. Make sure you know that one. Y'all sound like you know that one. Okay? So that's how you do, that's how dig works. Instead of speeding up like I have AFib, my heart's just boom, 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 boom. It's not pumping any blood out. So my body is dying. So it slows the heart rate down, allowing the heart to fill up blood, better cardiac output. But sometimes it can get too slow, and so that's when we have to draw a dig level, digoxin level. So people who are on dig, you have to check their dig levels. Okay. All right, and then the opposite of that's cardiac stimulants. They constrict the blood pressure. They want to increase the blood pressure. Now I've gotten my patient too low. Maybe they just had, you know, a real low heart rate for years, something, the contractility in the heart, electricity, they're older, and their heart has slowed down. So I have to give them something to stimulate them now, right? This is doing the opposite of what we've been talking about all morning. So I give them dopamine or dobutamine. This is for people who are going into shock or some kind of cardiac event where their heart rate is so low. We need to get their heart rate back up fast, okay? It's for extreme low blood pressure, cardiac stimulants are. What's another extreme cardiac stimulant that we give IV? Or into the heart. Epinephrine. It's a stimulant. It's what we've been trying to block on everything else. Okay? Alright, and then vasodilators, that's the other group. They do just what their name says. Vaso means vessel. Dilate, open up. Okay? They just dilate those smooth muscles, causing the blood pressure to lower, increasing oxygen supply to your heart. Okay? And there's some examples of what those are. Again, they cause a bad severe headache because they're dilating, and we want to monitor their blood pressure closely. If they're on a nitrite drip or nitroglycerin drip, you have to monitor their blood pressure extremely closely because it's going in their IV constantly. It's not like we gave them a pill and it's going to have a half-life of 2 hours. It's constantly, and it's immediate if it goes in the vessel, okay, into the vein. So you have them on a machine and you're watching them like a hawk, watching their blood pressure to make sure it doesn't drop. If it starts dropping, I titrate it. I will slow the rate down. That's what titrate means. Then, if it starts getting up, then the doctor will give you parameters, you know, where to keep the blood pressure at. If it gets above that, then I have to increase it again. I have to titrate it up. Oh, now I'm dropping down below the parameter. I got to titrate it down. And need them to have that much. And it will wear you out, but that is what you have to do on those kind of medicines, okay? It's very, very sensitive. Alright, diuretics. Yay, PP drugs, right? They help us get rid of our fluid. The whole purpose of a diuretic is to increase the fluid loss from the body. They get rid of the sodium, and we know water follows sodium, so if I kick all the salt out, guess who's going with it? The water. So I get rid of that. There's 4 groups of diuretics. There's loop diuretics, thiazide, and then potassium sparing and osmotic. So they're labeled on here 1, 2, 3, 4. I think the pages got out of whack on something else. So loop diuretics, guess where they work at? What part of the kidney? The loop of Henle. That's what I call that. Okay? They're the most effective group of diuretics. They work the most. They're very common. They block the reabsorption of sodium. So just like the other drugs, they go and at that kidney cell, they block it. They won't let any more salt in. So if the salt is floating around in the blood, in the outside of the cells, it can't get in. It says, all right, I'm leaving, and it goes out, and we excrete it. Okay. So again, when the salt can't get in the cell, the body gets rid of it, and the water goes with it. The salt and water are BFFs. Okay. And throw protein in there in this party. They're all free souls. Okay. So sodium goes, potassium goes right with it, and they get excreted out. When you get rid of fluid, that lowers your blood pressure, and then helps. That's the whole point of it. So maybe the other stuff we talked about earlier, they didn't need a vasodilator, they just had too much fluid, so we give them a diuretic instead. That helps control blood pressure too. It's not just for fluid, okay? These are people who have kidney disease. Why would they need a diuretic? Yeah, kidneys aren't working, doing their job, so let's give a little boost and help them, and we get rid of it that way. Okay? CHF patients and cirrhosis of the liver. Alright, some examples are Bumex, Lasix, and Demodex. Okay? Those are, and the generics are listed right there. Okay, if we're getting rid of sodium and potassium, what's the nursing lab that I need to be paying attention to? Potassium, sodium, potassium. Because especially potassium, because we know it can drop real fast with these little ladies, or the men that take them. And then they'll get too low potassium, you get cramps. Okay? And an irregular heart rate. Okay, so thiazides, they're not safe during pregnancy. You know, when you have a pregnant patient, they're real sensitive anyway about fluid. We're trying to grow another human. We need all the nutrients we can get. We don't need to get rid of a lot of fluid. We're trying to teach pregnant ladies to drink more fluid, right? To help build that baby. So this one they don't need to take in pregnancy, the thiazide diuretic. It works on a different part of the kidney, and it just helps prevent sodium from absorbing back into the cell, and chloride. Okay? It dilates the smooth muscles and helps us get rid of that fluid, thus lowering the blood pressure that way. Okay? When we don't have as much fluid floating through our blood vessels, the heart doesn't have to work as hard. It's like it's on vacation. It's like, oh, this is an easy day. Okay? So if the pump is having to work so hard, that keeps the blood pressure low. Okay? These thiazide diuretics, this is the deal with them. They have a real long half-life. They stay in the system a long time. So sometimes when we give, has anybody ever given IV Lasix yet at clinical? You give it, and within 10 minutes, boy, they're peeing like crazy coming out of their Foley. Even if they take their Lasix PO in the morning, by 10 o'clock, man, you've already changed them 3 or 4 times, or if they've had a catheter, you're emptying it like crazy, because it gets in there and works fast. Thiazide's kind of like the all-day slow release type thing, diuretic. They get in there and they stay in your system a long time so that they're peeing all day and all night. It's more of a consistent level. And that helps stabilize their blood pressure too. They're not real high and then real low. And now we got to fill them back up, and now they're back down. Because that's what loop diuretics do. It's too drastic of a drop. So thiazides, they realize, hey, this is more steady. Alright, so that's why they use that one. It has a longer half-life. But the bad thing about that is if it stays in your system longer, you're going to lose more potassium. Okay? So we definitely need to watch that one for those type patients that are on this medicine. They also help tells the body to reabsorb calcium, which is good because we know older people have osteoporosis. They already have trouble absorbing calcium. So know those, okay? But again, what does calcium do to my blood vessels and my heart and my muscles? It excites me. So if I'm trying to give them a diuretic to get rid of the blood pressure, the then this one makes me hold on to calcium. Maybe I'm starting to see it creep back up, okay? So it's just, it's really a game. You have to play with it all the time. Examples of this is all the thiazides, okay? Diureal, HCTZ, I've probably heard of that one, okay? With the thiazides, what your nursing intervention needs to be is to watch potassium levels and muscle cramps, and watch for low blood pressure, because again, it stays in their system a lot longer. So we got to be real slow with anybody that we're doing position changes on any kind of blood pressure test, but especially this one. The other big thing you have to watch out on a diuretic, but especially this one, because it stays in the system all day, is they get dehydrated. They forget to drink, they just are peeing all day. So they're peeing out more than we can get in them. So they're high risk of dehydration. Okay? Potassium sparing, that's the one, like I said, it makes you hold on, gets rid of the sodium and water, but not your potassium. So if they were on that loop diuretic earlier and now the potassium's so low, we have to stop that one. You just aren't holding on your potassium. So I'm going to go ahead and put you on this potassium sparing one. That way you're still getting rid of fluid, but you're not spilling your potassium, right? And that helps. These are for people with kidney disease, poor kidney function, or if they already have low potassium for some reason they don't make enough or something. Okay. Just watch for potassium levels again, because we don't want these to get too high. They're holding on to it. And then the last one is osmotic diuretics. These are mainly, you're really sick if you're on one of these. They're mainly for cerebral edema. Your head, your brain is swelling, okay? They'll give this to you. I think we had that in our case study. Somebody was giving mannitol. He had a head injury or something, and now his brain was swelling, and they give IV mannitol to prevent seizures. Because if you swell, that fluid builds up around your brain, causes pressure on the brain, you have a seizure. So they give this osmotic diuretic, mannitol, to get rid of that fluid around the brain. Right. Okay. Any questions on diuretics? Pretty straightforward on those. Some of the handouts you had on those, like lidocaine, epinephrine, atropine, and Narcan, do y'all know what those are for? Lidocaine kind of numbs the heart if it's irritated. You can give a lidocaine drip to help calm them down. Epinephrine stimulates us, gets us going. If you're having a asystole or a low heart rate, you give epi or atropine, or if you're having an allergic reaction, it's the epi shot that we give in the leg. Okay, and then Narcan, what's Narcan for? That's what we give people who come in unconscious and probably from a drug overdose. Okay, so Narcan, or really not even street drugs, they could be toxic on a lot of the medicines that we give our little elderly every day because their system doesn't get rid of it. So we can shoot them with an anti-Narcan. Okay, so those, I just thought those might be handy in case they ask you questions about those drugs. It's not. I was just missing one. Is it a paper? What? Yeah, but flip over and see what's on the back. Really?
I think that's what
You missed it. I thought I had given y'all that already anyway, but make sure if you don't, I'll make y'all some more copies of it. I thought that was one I gave y'all.
It had the diuretics and it had the first case.
I'll give y'all another one. Did everybody get this one the other day that had the osteoporosis on it? And then the Maslow's hierarchy, you really look at that, make sure you understand that you have to meet that need first before you can go up the pyramid. Or if they're here having an issue, you can't, you gotta fix that, right? Go back down, you can't, you gotta prioritize, that's triage. Okay. This handout is another one that drugs for bradycardia and low blood pressure. This would be something like we just talked about. We've already gotten this little patient too low now. Their blood pressure's too low, their heart rate's too low. So these are some of the drugs that they'll give to boost you back up. And we talk about dopamine, epinephrine, and atropine. But again, that's what those are for. just tried to give y'all as much farm reviews on the drugs themselves. Has anybody been making farm cards? Liars. Y'all like, yeah?
No, I got some. Studying those.
I saw it on your face. Lies.
They have some at
I just
Barnes and
always,
Nobles.
yeah, just
They
do
have
it.
the ones that are.
This is all you have to do, like digoxin, lanoxin. So you have both names. What is it for? You know, it's a CHF or heart, decreases heart rate. And then what do I need to watch for in that one? Check, apical pulse. That's all you need to know. But, you know what I mean? Like, just put the need to know stuff. You don't have to know what category your NS is. Just put the facts. Your brain can't absorb nothing but the simple stuff right now. You've got too much going on. All right. Heparin and Coumadin, everybody get this one? Everyone on apprenticeship?
They pass the guy.
Some people have it, so I'm just Okay, so heparin and Coumadin, what do those two drugs do? It's in the blood, right? Coumadin is the trade name for warfarin. And you have to just know that we are going to check the PT, the prothrombin time. This was a question I think y'all had because somebody was talking about lab work and meds, so this is a double whammy. I can promise you it'll be on that test because they love getting dual questions like that. So Coumadin, if that's within the blood, they take it daily. We're going to check their PT levels about every month, about every 30 days. And then heparin is also a blood thinner, but we give that one sub-Q, right? In the fat. Do we aspirate on that one?
No.
No.
Heparin, you give that, and you're going to do PTT. And it shows you a little way, like heparin starts with an H, so that's how you remember the PTT. That's PT like the H. Okay? So when you find that one, that's just an easy way to remember. Again, Coumadin and heparin. What is the antidote for Coumadin? If they get too thin, the antidote for Coumadin is vitamin K. And how do we know if they're getting too thin on Coumadin? What do we see? Ecmosis, bruising, TCI, okay, maybe blood in their urine, we hope not. They're real thin now. And then what's the antidote for heparin? Protamine sulfate. You need to know those, because that's an emergency drug. Coumadin, we give vitamin K if they're too thin. That's the antidote. And then heparin, the antidote is protamine sulfate. Okay. And the lab work you're going to check, you need to remember in your head, if I'm checking for thin blood, it's going to be PT, PTT. Right? Just like white blood cells equals infection. Thin blood, PT, PTT. And then you got your insulin. You gave y'all that one up because it's been a while. Everybody know how to draw up insulin? If you had to give them 2 times, which one do you drop first? The clear before the cloudy, okay? Just think you were happy and sweet like sunshine until you came to the cloudy nursing program. Now you're like a black cloud just waiting to rain. So just think about that. Clear to cloudy, okay? Because you don't want to put cloudy, you don't want to draw that up first and then stick that down in your clear insulin bottle because then you're contaminating your clear. Then your clear is not clear anymore. It's got clear and cloudy, right? So clear before cloudy on your insulin. Just in case they ask you that. Do y'all know your insulins?
No.
Why don't you know your insulins?
Hey, at least I was honest.
You were. So we need to work on that tonight, right? Look up insulins, make sure you know. Which one's the fastest? We did this last time. Regular. Our insulin is fast, so we actually know. NPH lasts a little bit longer. It's in your textbook, because I remember us talking about that in our last review.
YouTube is a good way of measuring too. I already forgot it.
Alright, what is salicylate? I can't ever say that word.
Aspirin.
Aspirin. So salicylate is just an acid, and that's what aspirin is made out of. Aspirin aspirin, and it's also abbreviated ASA, because it's the salicylic acid. So, can we give kids aspirin? Never. I think, what's it called? Rye syndrome, REYES. I think that was on AGI, because, Marissa had it or something. Somebody asked about it. Rye syndrome, so that's why we can't give kids, aspirin. And that is a lot of old grandmas like to still give aspirin to kids, because that's what they grew up on. And Rye's disease causes Iranian hearing damage, okay? So, you have to tell grandma, don't give this. What can she give instead if the child has, Tylenol or ibuprofen or nothing, okay? So make sure you know that. That's a big, thing they like to do. I'm gonna get you with that.
Thank you so much.
And then I gave y'all a handout, about the cancer drugs. Just kind of know what those do. I think everybody knows mostly what cancer drugs do. They just eat your insides up. It's going to cause bone marrow suppression. You're not going to be able to produce any more red blood cells, which is what causes, when you can't produce any more red blood cells, you get anemic. That's why our little cancer patients are always weak and fatigued, because they're not producing any red blood cells out of their bone marrow. And so then they, also, they have weak and they're anemic. They will have no appetite, nauseated, vomiting, a lot of GI upset from all of these drugs. Alopecia, what does alopecia mean? Hair loss. Okay. And then, of course, you want to avoid pregnancy while you're on these type of drugs, because they can be toxic to the fetus. Okay. Now, this one was on here a lot too, the MAOI inhibitor, or MAOIs. This is the one that they used to use these meds a lot. This is its own little class, and they used to use these meds a lot. But then they started finding out that there was so much stuff that people were eating when they were taking this medicine that really messed them up. There were so many foods that interacted with it, so now they hardly ever give MAOI.
For migraines.
Yeah, this is only, you have to be really strict out on it. So this one is good to memorize. If you don't look at any other of my handouts, please look at this one. There's lots that tell you what they are, but they would have sweating, tremors, elevated pressure. If they ate anything with like vinegar, like pickles, or anything that's pickles, cheeses, like hardened cheeses, no wine, no pickles, no cheese. Anything with tyramine in it, no tyramine. Those are the things, and that's like chocolate. I wrote it down on here somewhere else. What else is it? Soy sauce, all that kind of stuff. They can't have that if you're on an MAOI. Okay? So they give it for migraines, so that's what you have to teach your patients that has a migraine. They're on MAOIs. What foods can they not eat? Right? You know that one. And then I just gave you this one too about the lithium levels, DIG, and theophylline, like knowing where they're going to, be toxic at. What is lithium used for? Bipolar disorder. It's one of your psych drugs, and that one you have to be, it's really, really toxic. You have to check lithium levels, I think, every 4 to 6 weeks if they're on lithium. Make sure you know that you're going to be checking lithium levels and, to make sure they're not toxic. Okay? That's a psychotic drug. That's not from this one.
No.
This one. These are all from this morning, I think. And then lidocaine, we said earlier, cane is like an anesthetic. Like sometimes, when you're giving stitches, they'll give the lidocaine to numb you up, or they give you lidocaine before they pull your tooth or work on your tooth. You can also give lidocaine through the vein, and it numbs the heart. It's just like a numbing thing, like it does to your skin and your teeth, where you can't feel anything. It numbs the heart. So we will give lidocaine if the heart is really, really irritated, and they're having a cardiac event. But you can become toxic on it too. So it's one of those that has to be monitored very carefully. So I gave y'all that one just in case they ask you about it. They'll have slurred speech. Think about it's a sedative, okay? Like if I drank a 12-pack in 2 minutes, would I have slurred speech? Would I have an altered central nervous system? Heck yeah, everything's off, right? Because I'm numbing the brain. Muscle twitching, they're going to have tremors because the body's like, what is happening? And then they might even have seizures because they're so irritated, right? So just think about that in case they pull that one up on you. And then the little dancing pill bottles, did y'all see that one? Mm-hmm. Those are that's just an easy way for you to remember that those can't be together. They can interact. I mean, they can interact. So There's one in here about birth control. I gave these to Retta, but I don't know if she got these. So since we're talking about pharma. Birth control, we know oral birth control pills cause a lot of problems. Can you take them if you're a smoker? Probably you can, but you probably don't need to, because what do they cause? Side effects. Blood clots. High risk for blood clots. So that's on here. They can cause abdominal pain, because a lot of people, they say they're very nauseated with them, because it's a high dose of growth hormone. And so they tell them to take it at night, right? So you're taking it at night and giving them the GI upset. Chest pain, shortness of breath, because again, it's a hormone, so that tinkers with your adrenaline or your endocrine system, right? And so that might put it off. Headaches, because they raise your blood pressure, and we know headache, blood pressure. Eye problems, again, because you're raising your blood pressure, and then severe leg cramps because of blood clot risk. Do you remember any questions about that? This one was about when you're pregnant. If your patient's pregnant, they can't have quinolones or tetracycline. Why can't? What does tetracycline do to our fetus? It causes a lot of problems. So that's what happens on there. It can cause staining in the teeth. Cause a lot of hearing issues. What are the two organs that most drugs, most pharmacological drugs damage? Kidney and liver. Some, if you're on, some are nephrotoxic, meaning kidney. Some are hepatotoxic, and some are ototoxic, or ear toxicity. Which ones are those that can make ear damage? They're antibiotics. What kind of antibiotics? The mycin. I always remember, mice have big ears, and so those are your patient is pediatric, especially. They can be ototoxic. They can cause hearing damage. So the mycin are the group of antibiotics that you got to be real careful with, because they cause ototoxic. It's in here. You'll have it.
No, I'm just saying, I don't know why I'm
Versed, that's a conscious sedation medicine. I don't know that y'all will get that because it's kind of a specialty area, but just in case, understand Versed, they're consciously sedated. So you do monitor them just like they were under any kind of other anesthesia. Okay? And then, what is an anticholinergic effect? Why do we have that? Why do we talk about that all the time? Acetylcholine is one of those neurotransmitters we have in our body. What does it do? Y'all are dead. Yeah. Okay, if you're having a cholinergic reaction or cholinergic crisis, they're going to have, because normally it helps dry secretions. Okay, so any kind of fluids. But if you're in crisis, there's the thing that does for you. Okay. Salivation, like eyes dry out, urination, drying up, all that kind of stuff. Okay, so look up colon. No, look up if they're in a crisis, they have too much. So you need to look that up. If you don't understand acetylcholine, I can't teach it to you in here, but look it up. It's in your book, and it'll in your farm book, and just kind of clarify that in your head. Anticholinergic effects helps you dry everything up. So if they're in a cholinergic crisis, they're going to have too much. And peak to trough, y'all understand that? That's kind of like the half-life thing. We're talking about when you take it, it peaks at the best optimal time, that's when it's working the best, and then it goes down into a trough where it's kind of tapering off. They may ask you questions about that, so I just threw that in there. That's what we're doing farm. What is an anti-epileptic? What is that kind of class of drug? Seizure meds, yeah. Epilepsy, so it's an anti-epileptic, it's for seizures. On your in your farm book on page 247 and 248 and then 252, there's a list of them. Think about what a seizure is doing in your brain. Your brain is just firing off like crazy, and so you're trying to numb it. So that's what these do. They numb it. They cause CNS depression. Slows everything down. Okay. It's a sedative for your brain. So So what is the risk of things you would be watching for? Somebody who is sedated. First thing, think of your airway, breathing, circulation, right? It's gonna suppress respirations. What else? Aspiration, falls, confusion, or risk for injury. All right. So anybody that's on a seizure med, think safety. Okay. Airway and then safety. Dysrhythmia meds, we already kind of talked about that. Dysrhythmia means it's a heart arrhythmia, irregular heartbeat. So if we're giving them something for that, like Dig or lidocaine, we're trying to get their heart rate regular. All right. Anti-migraines, that's on page 245 in your farm book. There's one that's called Maxalt, and that's the one that you cannot open until you're about to take it. Like it's,
That's one.
yeah. Is it Black Label? Yeah. There's one that's like,
It's not Black Label.
there's one that's like super
It's an
toxic.
ALI.
And so it's sensitive to light, comes in like a foil package, and that's why you can't open it until you're about to take it, because sunlight will damage it, just like nitro, okay? Maxalt for headaches.
That's the one.
What's the medicine we talked about if you're trying to get somebody to go through alcohol abuse rehab? Anti-abuse. Think about anti-abuse. And it makes them do what? Vomit violently. If they take any alcohol and they've got that anti-abuse in their system, they will start vomiting, okay? When we're given dopamine, they can become toxic on that, okay? So they'll have what's called the, and this was, I think we talked about this one on the last test. They'll have what's called, and I can't even say it, blepharospasm. In case you see this word. And what is that? Does anybody know? They'll have eyelid spasms. If they are dopamine toxic. Hey, come on in now. Hi. Nay and baby, everyone. Hello, Nay and baby. They will have the fluttering of the eyelids, and that is the first sign you'll see if they're dopamine toxic. Okay? So just kind of, and it's worse if they have Parkinson's. Because who takes dopamine? Parkinson's patients. So if they have that, the fluttering of the eyes, the eyelids, think they're too toxic on their dopamine. Okay? Anti-Parkinson drugs, those are all in your book on 258, 59. Take after meals to avoid stomach upset for Parkinson's meds. No B6 with L-Dopa, okay? And no Wellbutrin. They interact. So they may throw those at you, but no B6 and no Wellbutrin with L-Dopa. And remember, they get fluttering eyelids. They're toxic. Your anti-anxieties are all in chapter 13 on page 262. There's lots of antidepressants. Effexor, E-F-F-E-X-O-R, that's the PTSD one that they give for panic disorders a lot of times. You have to taper off that one. You do not stop that one suddenly, okay? Effexor, E-F-F-E-X-O-R. You have to taper off. It's a PTSD, they use it for that, or just a bad panic disorder, anxiety disorder. You have to taper off that one. And then we talked about MAOIs. That's the one with the guy eating the cheese. That's a whole other group. It's on page 270. A whole other group of meds. And just make sure that you're watching what you eat. No tyramines in foods like cheese, yogurt, sour cream, raisins, bananas, avocados, soy sauce. Everything it sounds like in the grocery store. The way I remember that one, you know how all the fresh fruit and meat and cheese and vegetables are all on the outside of the grocery store? All of that has got tyramine in it, so you can't eat it if you're on an MAOI. So they ask you, your patient's on an MAOI inhibitor for blood pressure or whatever, and they ask you what foods they can't have, and they'll give you a list. Try to think about all the ones that are on the outside of the grocery store, or if it has like a coffee, tea, or chocolate, or maybe soy sauce. Causes a severe hypertensive crisis. If they eat that while they're on that MAOI, it shoots their blood pressure up and they can stroke out. Okay, so that's why that was a big, big deal. That's why they quit prescribing it, because people were coming in having strokes left and right, and it was because they were eating foods they didn't know they weren't supposed to eat. Okay. look to on pages 273, 74, and 76, again, anything that's trying to, psychotic is crazy, right? So if it's anti, we're trying to calm the crazy down. We're depressing them, right? So those are CNF depressants. They also, because they're depressing everything, they're going to decrease your cough reflex. So what do you think is going to happen if somebody has that kind of cough reflex? Depression. Yeah, their risk for aspiration or maybe choke easier, stuff like that, okay? They just have a decreased sensory overall. They're like real sluggish on these things. This one's like Haldol. An antipsychotic that's used a lot is Haldol. Okay? Anti-manic. Those are the ones that are like mood stabilizers, like lithium. When we talked about, I gave you a handout on that about the lithium, checking lithium levels. I think 1 to 1.5 is the normal range for lithium. Maybe it's a little different. That's for bipolar, manic, psychosis, all that. Sometimes they give that for ADHD, which is really scary to me. It's so toxic. How are we putting that in our little babies' bodies? But
Which one?
and then the last group was the ADHD on page 280. Those are just stimulants. ADD. You know, I need mine apparently. I'm all over the place.
I didn't take it.
That's a stimulant, and the reason these work so well, these little kids, their brains or adults, their brains are already firing off so fast that it doesn't make sense to give them a stimulant, does it? You're thinking, oh my God, they don't need any more stimulant. But what it does is it interacts with their chemistry in their brain, alters it, and it slows them down. So that's why a true ADHD child will thrive on a CNS stimulant, because they have the correct brain chemistry and it works well for them. Okay, they used to give coffee back before we had medicine for that. If you had a true ADHD child, you had to give them coffee.
It doesn't work no more.
We're morphing. We're turning into something different.
Exactly.
But anyway, just know that those ADHD are stimulants, so they're going to speed everything up. So what does that do if you speed everything up to a child's appetite? They don't want to eat. They're too busy. They feel good. They don't have an appetite. So what would be your nursing measure that you would watch for if a child with on ADHD? Monthly weights. You're going to watch their weight monthly every time they come into the clinic, or get the parent to weigh them monthly. They notice, if this is a growing child, we want them to grow and gain weight. So if they're dropping 1 to 2 pounds within a month, we need to notify somebody, right?
Yeah, and educate the parents to feed the child upon that.
I already tried to get every kind of it. All right, I'll take a break, and then I think that's pretty much it. Any questions on farm?
I really hate to trouble you, but I don't think a couple of minutes.
We'll go through and look. We'll go through and look all day.
That was a good little review.
And I got it recorded, so y'all will have it, okay? Just go back through your farm book. That's, just hit the highlights. If you know the categories, you can figure the rest out.
Put next to it farms.
Yes.
I know which one it is.
Stop that
The
one.
last few I was trying to look at it, it's like the weed, and I was like, I don't know. The number.
I'm going to put this one. I can look at them when I get home. Farm, this is farm.